Hello my people, welcome to my channel. How una day? It's been a long time. I hope everybody is fine. I'm so happy to be here with you again tonight after a long lull. It's not been easy, I have to confess with you, but we thank God. God has been faithful. Um, it's been busy, like I said, career, family, so many other things, and you know the way the world is going right now. So many things you have to put, so many things in place, and even me, I have to take care of my own mental health as well. So you are welcome to my channel, where we discuss mental health, psychiatry, and everything relating to mental health and psychiatry. Once again, tonight I am Akinloye Oyerinde, Doctor of Nursing Practice in Psychiatry and Mental Health. Today, I am here with you to discuss what so many of you know about. So many people who have struggled with mental health at one point or the other in their lives. They will know what I'm talking about. It's a problem that has refused to go away. So tonight, I want to bring our attention to this problem: why many people have not been using their medication, why many people have not been compliant with antipsychotics. The medication we use to treat mental health or behavioral health is called antipsychotics. So, whether you have depression, you have psychosis, you have schizophrenia, whether you have any of these mental health issues, you'll be prescribed with some antipsychotics to treat these issues. So today we want to look at some of the reasons why many people have not been taking their medication. As a practicing doctor of nursing practice, I've come across a lot of patients, and I keep seeing they keep talking about the same thing most of the time. It's not difficult for for the experienced one, to identify that a patient has not been taking their medication. When they come, you prescribe them with some medication. Uh, Before you know it, they go back. You want to see them in 2 weeks or in 4 weeks. Most of the time, 4 or 6 weeks, you want to see them, because antipsychotics or medications for psychiatry or mental health issues do not work immediately as other medications do. For example, if you have headache, you take Tylenol or paracetamol, within 10-15 minutes, the medication will kick in and it will work. If there are no other, if there's no other underlying effect that is making the headache get worse, you'll be headache free. You'll be headache free within 10-15 minutes. You'll be fine. Or for some people, you're suffering from insomnia. Once you take medications to help you sleep, like trazodone, like diazepam, Valium, or any of those medications like that, within 10-20 minutes you fall asleep. But antipsychotics are not like that. Antipsychotics for most people takes 4 to 6 weeks before you start getting the effect in your system. So some people cannot wait. They are so impatient, they just stop taking their medications altogether. Some people, it's the stigma itself that they cannot bear. How can this man tell me that I have I'm crazy? I'm crazy. Why should you tell? Why should the doctor say I'm crazy? I'm not crazy. I'm not weary. I'm not a weary. Weary means a mad person. Even here, a lot of people don't take it. They tell you they are not mad. Nothing's wrong with them. They are in denial most of the time. So, because the stigma is still there, they still think that what will people say? Or psychologically, they believe that it's only mad people who should be taking antipsychotics. And because they believe they are not weary, because they are delusional, they don't want to take the medication. So that's another reason. So another reason why people, from my experience, do not want to take their antipsychotics is because when you look at most of the effects, some other effects that we are going to be talking about tonight, you realize that most of this medication, true, they uh, if you are not strong, you don't want to take it. But there's hope. There is a solution to all of these side effects, and apart from that, we can make lifestyle changes. But don't let me get ahead of myself. Let me go through with the side effect first. Then we'll talk about some of the solutions that you can put in place to help you overcome most of these side effects. Another side effect that makes so many people not want to take these antipsychotics is because they begin to experience extrapyramidal symptoms. What are these EPS? Some of these are restlessness, rigidity, and facial movement. You see your face begin to move uncontrollable. It's not because it's like you have lost control of your face. You can't sit still. You are so restless. Some people is rigidity. They are so stiff they cannot move, and so many other things. Then there's another one that we call tardive dyskinesia. So some of these are problems that a lot of patients have come across, and they do not like such things. How can I be in a place, in a social place, and I can't sit still? You see somebody, yeah, or somebody, his hands are shaky. His hands are shaky. People, if you're not educated, you don't want to continue with this medication. You do. In fact, there are times you don't know that that's the medication you are taking is the reason why your hands are shaking or why you are going through all of this. And the moment some other people get to know it, they stop it straight away. And another thing to know is that antipsychotics are not like any other medications that you can just stop, because the side effect or the negative effect that will come across that will come thereafter will be so dangerous. It might make your life dangerous or put your life in danger. So another problem that people go through is constipation. A lot of patients have complained that when they are taking the antipsychotics, they become constipated. That is, they find it very difficult to go to the restroom to do number two. So they can't do number two, and because they can't do number two, constipation is not a simple thing like we thought it was. Constipation can be very, 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 very difficult and very bad. If you have a very bad constipation, you will cry at times for the feces to come out. So some people cannot bear it. They stop their medication as a result of that. Another reason is what we call neuroleptic malignant syndrome. The major thing that you experience here is high fever. When you take your medication and you begin to experience high fever, you should know that it is neuroleptic malignant syndrome. High fever is what you will see by that. So when you see that, seek for help immediately. So another one is the major one is weight gain. Weight gain, or what I will call metabolic changes. Metabolic changes means that you begin to gain weight. When you eat, you become hungry most of the time. Most of this medication will make you go hungry, and when you are hungry, all you want to do is either you're snacking every minute. You are snacking, you are eating. So before you say jack, your weight is getting out of hand, so you are gaining weight. And when you start gaining excess weight, what comes with it? You become diabetic. Yeah, you become diabetic. A lot of people start eating all kind of stuff, sugar. You just don't care. Whatever you find around is what you eat. So when you start eating, you gain weight, you lose shape, you become diabetic. And with this, so many people do not like the fact that they have gained weight, the fact that they now have diabetes. So they cut off the medication eventually. And apart from this other stuff, you begin to have cholesterol, high cholesterol, the bad cholesterol especially. So when you begin to have the bad cholesterol, it's going to start affecting your heart, your heart, and so many other things like that. And a lot of people, especially those who already have heart issue or cardiovascular issues in the past, it become aggravated. So a lot of people stop it. They stop their antipsychotic medications. So the other one is thirst. Most people who take antipsychotics have experienced at one point or the other, they've complained of thirst. They complain that they are always thirsty. All they want to do is just drink water, drink water, drink water. Another one which I will consider the major one why most people do not want to take antipsychotic is what we call is it affects their erection. A lot of people, especially the men, they complain of erectile dysfunction. When you have erectile dysfunction, it means your Thomas, your blockers, you understand? Yeah, your blockers, go stand like you used to stand before. And most of us, we do not play with this thing. Men generally, you understand what I'm talking about, that we as men, we see ourselves as the man, as the macho person. You want to be in control all the time. So when you start taking your antipsychotics, you begin to experience ED, erectile dysfunction. And apart from that libido, your interest goes down. You don't have libido. That is the urge to want to have sex is no longer there, or it diminishes with time. So that is the major one. Not only men, most of the time, a lot of women too have complained that they lost interest in having sex with their partners or with their husband. So they don't want any medication that will make them lose their libido, or that will kill their John Thomas, or that will cause erectile dysfunction in them. So that is why they are not taking their medication. So what do you do? What do we do when we begin to experience problems like this, all these problems that I have mentioned in this video today? One of the things we can do is that we can do lifestyle changes. Number one, make sure you see your psychiatrist or your nurse practitioner who has prescribed all these medications to you. Make sure you see them so that they can adjust the dosage of what you are taking. If you are taking like let's say you are taking let's say Wellbutrin 300 milligram, they can reduce it for you to like 150 milligram, or whatever you are taking. Let them reduce it, and let's see whether it's going to make a difference. Then another thing is that you can exercise. You can exercise regularly. In my other videos, I've talked about you exercising 3 times, 30 minutes, 3 times in a week. That's good enough. Just get out of your couch. Go and exercise. Whether you are taking medication that is making you overeat or not, you still need exercise. And another thing I'm going to say is that you need to watch out. Watch out. You know your body more than anybody does. You know your body, so make sure you are on the lookout. Look out for all the side effects, so that when they start coming in, you seek for help immediately. So you don't have to stop your medication, because when you stop your medication, it leads to other bad situations. The mental health issue becomes even worse. So why your doctors prescribe medication for you is that they have looked at it that, okay, the benefits outweighs the disadvantages. The benefit of the medication outweighs the disadvantages, the side effect that you are going to get. When you take the medication, you become a better person. You can focus. Your depression is not there. You can walk. You can do so many other things. Unlike when you don't take it, nobody wants somebody who has got skunk to work in their place of work. No, nobody wants that. Nobody wants anybody with skunk as a member of their family. No. So we need to consider. I cannot choose for you. Whatever you choose is your choice. Whether you want to remain skunk, or whether you want to be well and manage the side effect. Check out the word I use: manage. You manage the side effect. So this topic is very, very broad and very, very wide. We cannot finish it in just this 15-minute or 20-minute video. So some other time we'll find time to deal with it even more. Or even we do a live show where we have people to call in and they can discuss their experiences taking antipsychotics and what they did to reduce this problem. I thank you once again for sharing your time with me. I just want to say thank you very much. I really appreciate you. I have not taken you for granted. Please understand that hopefully from now we'll get back on our track and we'll begin to do very, very important topics that will benefit you, my fans out there. Thank you so very much. I really appreciate you, and I say you have a great week ahead of you. Once again, my name is Akinloye Oyerinde. If this video benefits you, please like, share, and subscribe. I'll see you in the next one. Thank you. Bye-bye.